Typical symptoms with a whiplash injury. Just as the intensity of a car crash can vary between minor and severe, the amount and types of symptoms can vary a lot too. In my years of practice working with people with different types of spinal trauma, I've seen people with minor neck aches, and I've seen people with pain so bad that they had to get drugged up and wear a cervical collar just to come into my office to see me. Here are the most common symptoms that people usually have after a rear-end car crash. The first symptom is no symptoms. Sometimes there can be a catastrophic injury to the back of your car, but you don't feel symptoms. Other times, little damage is done to the car, and there's still no symptoms. But don't be fooled. There still could be damage in your neck that you don't feel. The joint surfaces and discs in your neck don't have a good supply of nerve endings, so they may not be detecting damage. This is very serious for you because there may be damage that you don't feel right away, but you can later develop chronic problems year after the accident, if it's left unchecked. The next symptom is neck pain. 62% to 98% of people in the car crash develop neck pain. This is where the most damage occurs in the whiplash accident, the neck. This neck pain can vary in intensity from a minor ache to sharp, searing pain. Headaches. 66% to 70% of the people in the car accident later develop headaches. This can be 2 hours after the accident, or you could develop headaches 2 days after. The neck has a lot of nerve circuits that it shares with the head, and this can cause something called a cervicogenic headache. Shoulder pain. Many people develop shoulder pain after an injury because of direct trauma to the shoulders, a flare-up of an existing shoulder problem, or from referred pain down the neck. Low back pain and stiffness. Even though most people think of whiplash damaging a neck, a sudden collision that pushes your whole body from the back can also cause the curves in your spine to suddenly straighten and push forces upward throughout your spine, leading to low back injury. Blurred vision, nausea, fatigue, numbness or tingling, or ringing in the ear. One important and often overlooked thing that can happen in a whiplash injury is damage to the nervous system. Your doctor who checks you out should be looking at the subtle neurological signs in the physical examination that you may have after an injury. Make sure he does that. In my experience, doctors often overlook neurological symptoms when they treat injuries. While we are drilled on how to do a neurological exam called a cranial nerve examination, few doctors take the time to do it. There are 12 different cranial nerves, and each one takes time to test. The cranial nerves include nerves that move the eyes, control the way the pupil dilates, the sensation of the pinwheel and light touch on the face, hearing, taste, tongue movements, etc. One of my favorite tests to do with trauma patients is to check the quality of the movement of the muscles that move the eye movers. With trauma, you can be very fatigued in the eye muscles, yet no one is bothering to check it out. I wonder why. Other symptoms that you may experience in whiplash injury also include difficulty swallowing because the muscles are sore on the front part of the neck, irritability, fatigue, pain between the shoulder blades, pain in the arms or legs, feet and hands, or numbness or tingling, headache, as I said before, shoulder pain, pain in the jaw or the face, T&J pain. As you can imagine, each of these symptoms and the signs that we find in the neurological and the orthopedic examination need to be documented carefully, and they need to be followed over time. If the symptoms that you feel are subtle, then they can just go away on their own as your body heals itself. Still, they need to be properly documented for your own health and for your own good. Further, I've seen a lot of people develop chronic pain after having even moderate pain. As your body goes through the healing process, you need to make sure you heal with good function. The Neck Pain Task Force, a group of researchers and clinicians, put together a grading scale to describe neck pain. Neck pain is graded between 0 and 4. Most neck pain that we see in our office is 1 through 2. Oftentimes we'll see a 3, But here's the grading scale. Where do you fit in? Grade 0 is no pain. Grade 1, neck pain with little or no interference with daily activities. Grade 2, neck pain that limits daily activities, interferes with your quality of life. Grade 3, neck pain accompanied by radiculopathy. Radiculopathy is a pinched nerve. Radiculopathy produces pain, weakness, or numbness in the arm. Could be tingling in the fingertips. Grade 4, neck pain with serious pathology such as tumor, fracture, infection, systemic disease. It was beyond the mandate of the task force to study grade 4 neck pain. Grades 1 and 2 respond very well to conservative chiropractic care in our office. Grade 3 responds well many times, but we watch it to refer for a surgical consult when necessary. We don't deal with grade 4 neck pain because it has pathologies and fractures and tumors. If we find someone with a grade 4, then we refer out. So what happens to you when you are injured in a car accident? Watch the next video to find out.